Ever get that feeling, that there's more going on with your pet than meets the eye, like a whole hidden world?
Uh-huh. It's definitely something many owners sense.
Well, today we're diving into one part of that hidden world, hookworms. You've probably heard the name, maybe vaguely, but we're really going to get into the details.
Exactly. We're focusing today on canine and feline hookworm infection. The technical term is ancylostomiasis.
Ancylostomiosis, got it.
And we're drawing our information from uh, detailed veterinary resources to guide us.
Right, and our mission here is pretty simple, really. We want to give you a clear, useful understanding of these parasites. We're moving beyond just worms are bad to figure out how they spread, how the disease works, and most importantly, how to manage them effectively.
Keep our pets safe.
Exactly. So let's start at the beginning. What exactly are these hookworms?
Okay, so hookworms are a type of nematode parasite. Think roundworms. They set up shop in the small intestine of dogs and cats.
Nematodes. Small intestine.
Okay. And there isn't just one kind. For dogs, the big one is Ancylostoma caninum. You also see Uncinaria stenocephala and sometimes Ancylostoma brasiliens.
And for cats? Similar?
Similar players, yeah. Ancylostoma tubaeforme is the main one for cats, but they can also get A. brasiliens and U. stenocephala.
So quite a lineup. Are they all equally problematic?
Well, their location varies a bit. A. brasiliens likes the warmer southern areas, while the others are more widespread in temperate zones. But in terms of causing disease in the animal itself, it's really the Ancylostoma species. So A. caninum in dogs and A. tubaeforme in cats. They're the ones you worry about most for serious illness.
Why them specifically?
Because the adults, and even the fourth stage larvae of those two, are, well, pretty aggressive bloodsuckers.
Bloodsuckers, that doesn't sound good. What does that actually do to the pet?
It does exactly what it sounds like. They attach to the intestinal wall and feed on blood. And here's the really damaging part. Even when a worm moves to a new spot, the old bite site keeps bleeding for a while.
Oh, wow. So it's continuous loss.
Exactly. It leads to blood loss anemia, obviously, and inflammation of the intestine, which we call enteritis. It's a double whammy. Even a relatively small number of worms can cause significant problems, particularly in young animals.
That really highlights why catching it early is so vital.
Absolutely.
Now, the source mentioned different levels of disease, paracute, acute, chronic.
Yeah, those terms describe the severity and onset. Paracute is the most sudden and severe. You see that in newborn puppies, often infected through their mother's milk, especially that first milk, the colostrum.
Right, the colostrum transfer.
Acute disease is also serious, but perhaps slightly less rapid, often seen in older puppies. Then you have chronic infections in adult animals, which can be compensatory, meaning the body is sort of keeping up, or non-compensatory, where the body's losing the battle.
Okay. And what about that other one, Uncinaria stenocephala? The source said it's of little clinical concern.
That's a good point. It's included because, well, it is a hookworm found in dogs and cats. But compared to Ancylostoma, it doesn't usually cause severe disease in the animal.
So it's less of a direct health threat to the pet itself?
Generally, yes.
Yeah.
Now, Ancylostoma brasiliens is interesting too. While maybe not causing the most severe internal disease in pets, it's actually the main cause of something called cutaneous larva migrans, or CLM, in humans.
In humans, how?
The larva burrows into human skin, causing these itchy, track-like lesions. It's a public health consideration.
Mm-hmm.
And one other thing the source notes, sometimes as larvae migrate through the animal's lungs, they can cause some respiratory signs like a cough.
Huh. Okay, so multiple ways these things cause trouble. Let's talk transmission. How do pets actually pick them up?
There are a few key routes. A big one is just ingesting the infective larva. This could be in contaminated soil, food, water.
So licking paws after being outside, that kind of thing.
Exactly. Or they might eat what we call a transport host, like a rodent that's carrying the larva.
Right.
The other major route is skin penetration. The larvae can actually burrow right through skin, often on the feet or belly. And then, as we mentioned, there's that specific route for A. caninum transmammary transmission.
Yeah.
Directly from the mother dog to her pups through the milk.
Okay, so they can get in through ingestion, through the skin, or from mom. Got it. Given all that, what are the signs an owner should be watching for? What are the clues?
It really depends. Age is a huge factor.
Mm-hmm.
Young animals are much more likely to show severe, acute signs.
Because their immune systems aren't fully developed yet.
Precisely. And they have smaller blood reserves. Adult animals, on the other hand, might be asymptomatic, show no signs at all, or they might have more subtle chronic issues. And generally speaking, dogs tend to show more severe signs than cats do.
Okay, so for an owner at home, what might they actually see?
Key things to look out for. Pale gums or the inside of the eyelids, that points to anemia.
Correct.
Dark, tarry stools, the technical term is melena, that's digested blood. Definitely a warning sign.
Like road tar, the source said.
Yeah, that's a good description. Also, diarrhea is common, though sometimes you might see constipation instead. Just a general failure to thrive, poor appetite, losing weight or not gaining properly, and maybe a dry sort of hacking cough if larvae are migrating through the lungs.
And in the worst cases.
Tragically, especially in very young, heavily infected pups, sudden death can occur even before you see many other signs.
Oh, that's awful. And if they get to the vet, what might the vet pick up on examination?
A vet would look for things like poor overall body condition, maybe a rough, unhealthy hair coat, that general ill-thrift look. The pale mucous membranes are a really significant finding.
Right, the anemia indicator.
Yeah. And they might find skin issues, especially on the feet, red, itchy bumps or lesions, particularly between the toes, suggesting where larvae might have entered.
It really does sound like young animals get the worst of it. Why are they so much more vulnerable?
Well, we mentioned the immature immune system. The transmammary route is a direct hit for newborns. But also, think about their environment.
Kennels, whelping boxes.
Right. If the mother is infected, or the environment is contaminated with feces from infected animals, those puppies are living right in the source of infection. They have a much higher exposure risk.
Makes sense.
Plus, any other concurrent issues, other intestinal bugs, poor nutrition, the stress of pregnancy for the mother, all these things can lower resistance and make the hookworm infection worse.
Okay, so if a vet suspects hookworms based on the signs and the animal's history, how do they nail down the diagnosis? I assume other things could cause similar signs.
Yeah, absolutely. Differential diagnosis is crucial. You have to rule out other causes of anemia, things that destroy red blood cells or cause blood loss elsewhere.
Like what?
Well, other parasites can cause digestive upset, like roundworms, Ascariasis, Coccidia, or strongyloids, although those don't typically cause the same level of anemia as hookworms. There's even a stomach worm, Physioloptera, that can cause some bleeding and mild anemia.
So ruling things out is key. What about lab tests? Blood work.
Yes, blood tests are very helpful. A CBC complete blood count often shows a high number of eosinophils, a type of white blood cell that often increases in response to parasites. And of course, you look for anemia. The specifics of the anemia can even give clues about how long it's been going on.
How so?
Initially, with acute blood loss, the anemia is often normocytic, normochromic, regenerative, meaning the red cells are normal size and color, and the body is trying hard to make new ones.
Okay.
But if it becomes chronic, the body can run out of iron from the constant blood loss. Then the anemia might become microcytic, hypochromics, smaller, paler red blood cells. Seeing that suggests a longer-term problem.
Interesting. But the definitive test is looking for the worms or their eggs, right? In the poop.
Exactly. The primary diagnostic is fecal flotation. You mix the stool sample with a special solution, and the parasite eggs float to the top.
And you see them under the microscope.
Correct. Hookworm eggs have a characteristic look. They're called morulated strongulate eggs, basically oval eggs with a cluster of cells inside. There are tiny size differences. Uncinaria eggs are a bit longer than Ancylostoma, but generally they look similar.
But there's a catch, isn't there?
Yes, a really important one, especially with those paracute cases in young pups. Severe disease and even death can happen before the adult worms mature enough to start laying eggs. It's called the prepatent period.
So a negative fecal test doesn't absolutely rule it out early on?
Correct. In sad situations where littermates have died with similar signs, a post-mortem examination or a necropsy can be very revealing.
What would they actually see during a necropsy?
Visually, you'd likely see the small worms attached to the inside lining of the small intestine. You'd see those little bleeding ulcerations, the bite sites dotted along the intestine. And you might see free blood within the intestine itself. Microscopically, you often find what's called eosinophilic enteritis, that inflammation we talked about, with lots of those eosinophil cells present.
Okay, diagnosis makes sense. Let's talk treatment. What can be done once hookworms are confirmed?
The approach really depends on the severity. For those really sick, paracute, or severe acute cases, especially in young animals, they usually need hospitalization, intensive care.
What does that involve?
It involves giving the deworming medication, the anthelmintic, but also crucial supportive care, IV fluids for dehydration, potentially blood transfusions if the anemia is life-threatening, maybe even oxygen support.
It sounds really serious.
It is. And it's important for owners to understand that even with the best care, the prognosis can be guarded, and sometimes pups still succumb. It's a tough situation.
Understood. What about the less critical chronic cases?
For chronic cases where the animal seems to be coping okay, the compensatory one's treatment might just be the appropriate anthelmintic. But for the non-compensatory cases where the animal is clearly run down, they need the dewormer plus nutritional support.
Like iron supplements you mentioned.
Exactly. Iron supplementation, maybe a high-quality diet to help them rebuild their strength and red blood cells.
The source listed a whole bunch of different drug names. Are they all doing the same thing?
They fall into a couple of categories, generally. Some medications, like fenbendazole, milbemycin oxime, which is in many heartworm preventatives, moxidectin, imodepside for cats. These are good because they kill both the adult worms and some of the larval stages.
So they target different life stages.
Right, which can be important for stopping the cycle.
Right.
Then you have others like pyrantel, palmetto, a very common dewormer, and various combinations including praziquantel or fenbendazole and selamectin, which are primarily effective against the adult worms living in the intestine.
So the vet chooses based on the specific situation.
Yes. They'll consider the age of the pet, the severity, whether they also need larval control, and the best way to administer it, oral, topical, etc.
And after treatment, you need to check it worked.
Definitely. Follow-up is key. Typically, this involves repeating the fecal flotation test a few weeks after treatment to ensure the eggs are gone.
Makes sense.
And if the pet was anemic, the vet will want to recheck the hematocrit, that measure of red blood cells, to make sure it's coming back up to normal.
Okay, treatment is clear, but prevention sounds even better. What's the strategy there?
Absolutely. Prevention is the goal. There are specific strategies, especially for breeding animals, to minimize transmission to newborns.
Like what?
For mother dogs, the source mentions giving fenbendazole late in pregnancy and during early lactation, or using ivermectin strategically around whelping. This helps kill off adult worms and also targets those dormant larvae in the mother's tissues that can reactivate and infect the pups through the milk.
Ah, targeting those sneaky dormant larvae.
Exactly. For the puppies themselves, the standard recommendation is deworming every 2 weeks, starting at about 2 weeks old and continuing until they are weaned.
Every 2 weeks. That seems frequent.
It is. But it's time to catch worms developing from that continuous exposure via milk or the environment before they mature and cause significant blood loss or shed more eggs. After weaning, especially for high-risk pups, monthly prevention is often continued.
And for cats and kittens.
Similar principles. Treat the queen cat with an effective dewormer before breeding and after she gives birth. Start deworming kittens around 3 to 4 weeks of age, and then continue monthly. Many monthly heartworm preventatives also control hookworms.
Beyond the medications, what about the environment?
Crucial. The single most important thing is prompt removal and disposal of feces. Daily cleanup.
Stop the eggs from contaminating the soil.
Precisely. Hookworm larvae develop in the environment from eggs shed in feces. If you remove the feces quickly, you break that cycle. Also, trying to prevent pets from hunting or scavenging rodents or other potential transport hosts can reduce risk.
Right, so managing the environment and consistent deworming, what's the overall outlook then? If a pet does get hookworms, what can owners generally expect?
Well, as we've said, for those very young puppies with severe caninum infections, the prognosis can be poor, even with treatment. It's a very dangerous disease for them.
But for other cases?
For most other cases, older animals, less severe infections, infections with less aggressive species, the prognosis with appropriate deworming and nutritional support, if needed, is generally very good. Full recovery is expected.
That's good news. Is there anything else owners should be aware of?
One thing to remember, particularly with adult dogs, is the issue of those dormant larvae we mentioned. Even after successful treatment of the intestinal worms, these larvae can persist in the tissues. Stress or deworming itself can sometimes trigger them to reactivate and move back into the intestine, causing a new infection.
So ongoing prevention is important, even in adults?
Yes, regular use of broad-spectrum parasite control products is really the best strategy long-term.
Okay. This has been incredibly informative, a real deep dive. If we were to boil it down, what are the absolute key takeaways for our listeners?
I'd say, number one, understand that hookworms, especially Ancylostoma species in young pets, are serious business because of the blood loss they cause.
Right. Potentially life-threatening.
Number two, learn to recognize the signs: pale gums, dark stool, poor condition, and act quickly if you see them. Don't wait.
Early detection is vital.
3, know that effective treatments are available. Your vet can help choose the right one. And finally, number 4, prevention is paramount. Regular deworming protocols, especially for puppies and kittens, and good sanitation are your best defenses.
Excellent summary. Considering how persistent and frankly sneaky these parasites are with their life cycles and dormant stages, it really makes you wonder what other invisible challenges might be affecting our pets' health day to day.
It's a complex biological world out there.
Definitely. Perhaps this discussion sparks some curiosity for you, the listener, to delve deeper into parasitology, or maybe just have a more proactive conversation about preventative care next time you visit your vet. Thanks for joining us for this deep dive.